Good evening. We warmly welcome all of you who have joined today on our very first webinar of Colombo Physiotherapy Week 2021. Physiotherapy Students Welfare Society of Faculty of Medicine, University of Colombo proudly presents you the Colombo Physiotherapy Week 2021 to commemorate the World Physiotherapy Day 2021. We will be having a set of webinars starting from today onwards till 8th of September, where you can widen your knowledge on many areas regarding physiotherapy. So today we have Mr. Rajkaran with us as our honorable guest speaker, who is also a physiotherapy graduate from University of Colombo. He is a certified Boba therapist, certified meals therapist, certified international aquatic therapist, and also certified in special yoga for special children. Good evening, sir, and we warmly welcome you. And as you already...
Okay, thank you very much. Sorry, okay, please continue. Sorry.
As you already know, today our topic is pediatric physiotherapy. We will be focusing on role of pediatric physiotherapy, process of pediatric physiotherapy, treatment methods of pediatric physiotherapy, and important points that parents should know regarding children. So if you have any questions or anything to be clarified during the webinar, please feel free to send it to the chat or the WhatsApp group so that I can direct them to the speaker at the end of the session. This is the moment we have been waiting for. I would like to invite Mr. Rajkaran to address the audience. Over to you, sir.
Thank you, Danny. Okay. So good evening, everybody. It's nice to see you all. Hope you are all fine and healthy. Okay, can you see the screen? Nalini, can you able to see the screen clearly?
Yeah.
Okay. Good evening, everybody. It's my pleasure and thank you very much for this invitation in a great event like World Physiotherapy Day. Okay, today we are going to talk about pediatric physiotherapy and what's the process of the physiotherapy and an introduction about pediatric physiotherapy. Okay. So as Darren said, if you have any questions, please let me in the chat and we can discuss later. Okay. Okay, we know the physiotherapy is a form of medical treatment, and it was used all of the age group. Okay, from birth to until we die, we need a physiotherapy at one time. Okay, right. When we consider about the pediatric physiotherapy, our population will be from birth to 18 years. Okay, whoever clients come within that age limit, we have to treat the client as a pediatric physiotherapy perspective. Okay, so let us think what are the conditions you might encounter as a pediatric physiotherapist. There are parents and children come with neurological conditions like cerebral palsy, and there are some clients come with musculoskeletal conditions like fracture or myopathies, and there are some conditions related to respiratory conditions like asthma. Or nowadays everybody knows corona because physiotherapy plays a major role in COVID-19, and some children might have some cardiological issues. Some children come due to brain injuries after some fire accident. Some clients are oncological after some brain tumor or some other tumors. And some children especially comes for obesity, the childhood obesity. It's a very significant and growing problem in nowadays. And pre and post surgical conditions, children who underwent any kind of surgical or post surgical conditions. So when we consider about these conditions, for some conditions we can directly help the child to overcome the conditions, but sometimes we can't help the child to overcome the condition, but we can help them to reduce the complications, secondary complications, and we can enhance the quality of life of the child. For example, if the child came to your office with a tumor, definitely physiotherapist can't help to cure the tumor, but we can help the child in reducing the pain and developing their quality of life, but by developing their functionality and movement and sort of things. So, however, our main aim was making the client functional independent and enhancing their quality of life. So whatever the conditions, the parents or the child come to your office, and they will say they have some certain problems, like my child was having a development problem. So they will say my child was already 1 year old, but still he's not sitting without support. So it's a problem. And some parents or children may come to your office and say, I have some movement problem, like my child was frequently falling. Some others complain postural problems by, like the child may having some curvature in the spine, or some other knee problems or knee abnormalities or ankle abnormalities, like other deformities. Some parents or child come to your office and say pain, because my child is having severe headache or neck ache or back ache or knee pain. While he was playing, he was feeling pain in the foot or some else. Even some children or parents come and complain you about educational problem, because due to back pain, my child was unable to focus on the studies, or due to headache, my child was unable to continue his studies, or my child was unable to write for a longer period of time, or unable to hold the pen or pencil properly. Likewise, there are so many other educational problems, and the list continues. I have given a few problems, but there is huge list. Okay, so whatever the condition, we basically divide the condition into two main category. One was congenital; it means the problem comes from birth, and other was acquired. The problem start after the birth. Okay, so sometimes, even some occasions, we divide some condition from a genetical perspective, like conditions which are caused by genetical reasons, and others which are not known genetical conditions. But very frequently we use congenital and acquired conditions. But whatever things happen, we and other health professionals who are in the pediatric field, we always recommend, please follow the child development and growth at least for 7 years, because the child may have born normal and develop normal for a few years. After that, he might go regression in the growth. For example, there are some children called myopathies with myopathies and DMTs. They are fine. Their birth was good. They are normal, and they develop for 3 or 5 years. They are developing perfectly. After that, suddenly they started to reduce in their development. Okay, and also there are some instant, like learning disability. Those we can't see in the previous years. Even we can have some signs and symptoms mild, but we can only diagnose the children after they started the academic. So because it's highly recommend, please follow the children, even they are normal in the development of birth. Please follow the development and the growth of the child until 7 years. Okay, so the point was, when the parents when the parents and the child was thinking about going to meet a physiotherapy, they are confused, because most of them, they never heard about physiotherapy, and they was thinking about, okay, what's going to happen? What are they going to ask? Are they going to tell something about my child in a worst case? Or there are so many confusion. So as a physiotherapist, you need to understand the mental states of the parent and the child, because they are anxious and nervous. Okay, right. So when somebody when some parents called you to ask an appointment, so you have to give some information, ask them to bring some information to start the assessment. First, ask the parents to bring all the previous histories and reports to look what happened previously. And also, if the child was having any preferable toys, ask the parents to bring it there, because if you're having a preferable toys, the child will be confident or comfortable, and we can do our assessment very easily and very in a comfortable manner, because the child was comfortable. Okay, Right, and also these toys may give us the status of the children. What about his cognition level and how he deal with the play, and what are the limitations? So we can get some ideas from the toys. And also, we highly request the parents to bring any assistive devices, not only walking aids like A4, walking frames, or clutches or something. We highly recommend to bring the communication devices and other assistive devices, because these assistive devices give a clear picture about the child as a holistic. Okay. Okay, so then the next thing, it's important thing, please, and if there are any parents in the group, they have to understand, don't prepare the child before the session. Okay, because I know some parents before coming to the session, they will tell to the child, if you behave well, I will give you chocolate or whatever you like. Okay, so we can't see the real picture of the child. Okay, so please come with an open mind, so then we can see the real picture of the child and we can help, we can do our best to help you. Okay, and this is another very important point. In my first visit, I always invite both the parents to be present, because both parents parents will having equal responsibility. Okay, even though they might have some different opinions about the children and their expectations, but they need to be there. Okay, not the only the mother was responsible, or not only the father was responsible for the children. Both parents are responsible, and we highly recommend both of them are present at the initial assessment. And if possible, if the child was able to speak, let the child to speak, because some of the signs and symptoms are very subjective. So it's very easy to understand when the child speaks what he or she feels, or what's her problem. Okay, so let the child to speak. Okay. Okay, so we are now we are going to the next step. As we see, there are huge conditions who need pediatric physiotherapy, and they come with different complaints, problems like pain, posture impairment, and movement impairment. So those are signs and symptoms. Okay, so we can't treat the symptom. Physiotherapy will never treat the symptoms. The ultimate goal of the physiotherapy, they find the root cause for the problem. That's the key. That's the specialty of the physiotherapist. Okay, so they will find the root cause. What is the root cause for the postural impairment? No, what is the root cause for the movement impairment? Or what is the root cause of the pain of the child? Okay, then he started the treatment. So to understand the root cause, we need to assess the child very clearly. Okay, so the physiotherapy process consists of four basic steps. Number one, the assessment to find the root cause. Number two, the goal setting, what we are going to do for the children, and the treatment. Okay, what's the intervention we are going to do, and reevaluation. Have we achieved the goal or not achieved the goal, or how we are going to progress further. Okay, so we are going to deal with each step separately. Okay, right. The first step, assessment. So the main reason of the assessment was finding the root cause. It's like collecting the data. Okay, right. So we need some data in order to figure out what's going on with the child. Okay, to collect the data, we use several steps or several tools to get information. One was history taking. We asked several questions from the parents and the children to understand what happened, like what happened to the child, when it happens, how long the problem is there, and what's the birth history of the child, or some other stuffs. Okay, so this was very subjective assessment. Okay, so after that the physiotherapy will do a special test. Okay, which is an objective finding. He want to know what's the body part or what's happening in the body, and what's the reason for that. Okay, right. So okay, so excuse, somebody have saying they are unable to see the client. So what about now? Is it okay? Is everybody can see the presentation clearly?
I think, yes, sir.
Yes,
We can
okay.
see it.
Okay, okay, thank you. Okay, if anything, please let me know. Okay, sorry. Right. So the next thing, they will do some measurements. Okay, because they have to know is certain problems are within the range, within the normal range, or it's not in the normal range. It's less than the normal range or greater than the normal range. Okay, so this we call as an objective method because we usually use SOAP method. S for subjective assessment, like history taking. O belongs to objective assessment, like special tests and measurements. And the next will be the P for planning, and sorry, A for analyze, and P for planning. That's a SOAP method. Okay, right. Okay, after we getting the information, the physiotherapist started to do the problem solving stuff. He analyzed what may be the reason for the impairment or what may be the reason for the complaint. Okay, and he will figure out, and he will discuss with the parents, this is the cause for the problems. Okay, after that, the physiotherapy and the child and the parents together set the goal. It's very important, highly important. We need to include the child and the parents in goal setting. Okay, it is not the only the therapist was setting the goal. It's not a correct practice. Okay, we need to include the parents and the child and their perspective about the goal setting, because if we make them to understand what's the goal and how we are going to do it, they will follow the goal. Then ultimately we can find a better output. Okay, right. Okay, so in during our goal setting, we use some different techniques. Most of the time we use SMART. Okay, the S stands for specific, M for measurable, A for attainable or achievable, R for relevant or reliable, T for time-based. Okay, when I make it a sentence, like we have to set a realistic, specific, measurable goal, which we can achieve within a time frame. Okay, I'll say it again. We have to set a reliable, specific, measurable goal, which we can achieve during that certain time period. Okay, it's very important. Okay, because if your goal is not reality or realistic, definitely we can achieve it. If we can't achieve it, what happened? The therapist was distressed and frustrated, the child was frustrated, and the parents was frustrated, and everybody were frustrated. So what will happen? There will be a gap between the therapist and the parent. So definitely we need to set the goal in smart way. Okay, I can see somebody was raised the hand. How can I help you? Is there anything in the chat box?
No, sir. I think it's a mistake.
Okay, so cool. Okay, good. Right. So we usually divide the goal into two major categories: short-term goal and the long-term goal. The thing was, most of the time when the parents come to you to say, okay, my child is not walking, or I having this problem, my child was having this problem, most of the time it's a long-term goal. In very few occasions, it will be a short-term goal. Okay. So what we usually do was we break the long-term goal into small pieces, and we make a short-term goal, and we plan it. We plan the short-term goal and we achieve it, and then we go for the next short-term goal, and when we achieve that, we move on, and finally we achieve a long-term goal. Okay, because if we have a short-term goal which is easy to achieve by a child and the parents and easy to understand, okay, because the child was not stressed and he will develop very easily and very fast. Okay, so it's very important. Okay, right. Okay, so it's very important. ICF, we call it International Classification of Function, which is developed by WHO around 2001. Okay, right. So in this model, they have highlighted the health conditions have three components. Okay, the body, when the child having a health condition, it can be a disorder, it can be a disease. Okay, either of that. Okay, they have an impairment in body structure and function. Okay, Due to that body function structural impairment, he might have limitation in activities. Due to the limitation of the activity, the child may have some restrictions in participation. Okay, right. We see it in example. For example, the child runs in the child was playing in the ground and he fell down and he got a fracture in the leg bone. Okay, what's the body function and structural impairment? It's bony fracture is the impairment. So due to the bony fracture, what happened? Now the child was unable to walk. It's an activity limitation for a certain period of time. So due to that activity limitation, it means unable to walk. What happened? Now the child was unable to go to the school, unable to go to the sports, or unable to participate in the party, or unable to go to the supermarket. Okay, those are participation the restrictions. Okay, when we assessing the child or when we are planning about the treatment, definitely we need to think about the three major components like body function structure, activity, and participation level. Because at previous decades, we only focus on the body function and structure. Okay, it's our limitation. Now we are very highly recommending we have to follow the ICF, which give a good, better outcomes. Okay, so and also there are contextual factors. We can divide the contextual factors into two different categories: personal factors and environment factor. For example, when we think about personal factors, the motivation level of the child, the age of the child, whether he can understand or can't understand, or the gender of the child, those are very much influencing the activity. Because if the child is highly motivated, then he will engage in the therapy very highly, engage in the therapy, and we can get better outcomes. Okay, right. And the environmental factor, which is most of the time belong to the policy makers. For example, let's say there's a child in a city A and there's a child in a city B. The malls in the city A all have ramps. The malls in the city B doesn't have any ramps, only have the staircases. So think, there are two children in city A and city B who are wheelchair bounded. Okay, right. Now think, what happened to both of the kids? The child who is in the city A was able to go around the malls because he has the accessibility, the ramp, and he can buy or he can get whatever he need. But the child in city B, even though he can move by the wheelchair, but he was restricted due to what? Due to environmental factor. So we have to think about the environment very seriously, because those are influencing the child accessibility and the development. Okay, so please always remember the ICF model. Okay, right. So before moving to the treatment, do you have any questions, or are you okay now? If you are okay, just put yes in the chat box. Okay, or if you have any doubts, please let me know. Okay, there are a few people says yes, yes, yes. Okay, it's very happy to see the yes. Okay, we're done. Okay, good. Okay, now we move to the next session. Okay, I summarize once again. I summarize what we have learned until now. Okay, in physiotherapy treatment, we have certain process. There are 4 steps. Okay, the first one, the assessment. Okay, to find the root cause. Okay, the second one, the goal setting. Okay, right. The third one was the treatment, and the fourth one, the reevaluation. Until now, we have finished the assessment. First step, the assessment, collecting data subjectively and objectively, and then we have done with the goal setting in a smart way. Okay, now we are going for the third step, the treatment. Okay, good. Okay, so now we have identified the goal for the child. Okay, so then the therapists have to think. Okay, just hold a second. Right, sorry. So that to achieve the goal, the therapist now have so many treatment techniques, so many approaches. But he have to figure out which is the appropriate strategy or most efficient treatment for that child for that particular situation. Okay, it's a crucial thing. Okay, that's your expertise. Okay, because to a certain goal we have so many approaches to, to achieve. Okay, but you have to identify the correct tool. Okay, that's a key thing. Okay, now we have identified the goal and now we have a strategy. Okay, how we are going to do that. Okay, right. Then we have to think about the progression, because when in the beginning of the therapy, we have to engage the child in a simple task or simple exercises. Then we have to add complexity little by little by little by, and then finally we give a more complex task. Okay, so we have to plan a progression plan which the child can do it easily and comfortably, and we can get our output. Okay, right. Okay, if we have a good goal, perfect goal, and a good strategy, treatment intervention, and a good progression plan. Okay, so then now we can start the treatment. Okay, right. So during the treatment, it's very important, the crucial thing, the support. Most of the people believe we don't need to give support for the children. No. If the child want to learn, if the child need to develop, definitely you need to give support, but not too much support, not too much less support, very appropriate support. That's a key thing. That's the skill the therapist need to do. Okay, this skill shows you're expert or not the expert. Okay, right. So some children need support at the beginning of the session. Some children, they are okay, fine with the beginning because it's a simple, but when we progress, when we add the complexity in between, he needs some support. Okay, so it's very important. The therapist have to be proactive, not reactive. Okay, you need to be proactive. So proactive, and you have to act very fast. When the child needs the support, you have to deliver the support, the appropriate support. Okay, because during the therapy, it's a relationship between the client, with the child, and the therapist. The relationship is built up with the trust. If you are not giving appropriate support, the trust, you are breaking the trust of the child. So after that, the child is not going to cope with you. Okay, so the trust is very important. To build the trust, you need to give an appropriate support at the correct time. Okay, it's very important. Okay, there are different amount of supports and different form of support. The physiotherapists need to understand which form of support, how much support I'm going to give for this child at this particular time. Okay, some children may need the support from the therapist. Some children may need from the support from the parents for the psychological confident. Some children may need some equipment support like walker or walking aids or something. So it's crucial to understand how much amount of support you need to give the child, and what form of support you are going to give. Okay, it's very important. Okay, good. Right. So during our therapy, not only we are giving this support, but sometimes we have to give some barriers like constraints, because sometimes the child may go in a wrong way. So then again, we have to give something to bring it back to the correct way. Okay, so that's we call constraints. Okay, so because we have to keep the child in the right pathway to achieve our goals. Okay, good. Okay, when we started the treatment, and if everything is going fine, if we give appropriate support, then we'll achieve the goal. Okay, so after we achieving the goal, for some children, it's the end of our treatment. Because if it's a simple case, okay, your treatment was finished, they can go to their normal life. But most of the time, what will happen was, it's the beginning of the next level. Because remember, we talk about the short-term goal and the long-term goal. Okay, it might be the short-term goal of the children, of the child, which we have achieved now. Then we have to think about the next level in order to achieve the long-term goal, which is functional independence. Okay, which is a crucial thing. Okay, right. So before moving to the treatment technique, there's one message from the chat box. Let me check. Okay, 1 year baby can't even turn on their own, diagnosed hydrocephalus stage 1. Okay, please suggest some core strengthening exercises. Okay, definitely I will help you, and I'll give you the answer at the end of the end of the session. Okay, right? Because we still in the we haven't started the treatment technique for now. Okay, we'll discuss it later. Okay, I remember. Okay, please remember. Okay, right. Okay, so any other questions before we move to the treatment techniques? If you are okay still now, once again, please type yes. Then I can get a feedback, and then I will be happy you have got the key messages. If you have any questions, please ask me. You are always welcome. Okay, okay, okay. Okay, thank you very much. Thank you very much for your valuable feedbacks. Okay, right. Okay, so now we can move to the treatment techniques. Okay, so in physiotherapy, in pediatric physiotherapies, there are thousands of therapies, treatment techniques. Okay, I have just put some examples there: Boba therapy, PNF, motor learning, sensory integration, and CMT, consent-induced movement therapy, and conductive education and voice therapy. All of them are treatment techniques. Okay, as a physiotherapist, you definitely need to understand what are the treatment techniques and how to use those stuffs. Okay, because it's your skill. Okay, because each of the treatment techniques we need someday. Okay, right. So if you follow, sorry. Okay, we see this slide before, and there are so many other stuffs. Okay, like therapeutic exercise, aerobic, manual therapy, or electrotherapy, functional electric stimulations, and breathing exercises, which we are commonly using in nowadays in COVID patients, and as technologies or critical care exercises or critical care techniques, which we use in the ICUs nowadays. There are so many treatment techniques. Okay, so this is a very basic webinar, so I am not going to each and every treatment techniques. Okay, so if we have a next chance, I'll try to explain this. Okay, right. Okay, what's the end of the question? Okay, now we have done the assessment, we set the goal, and now we are in the treatment phase. We have lots of thousands of treatment technique. So the thing was, now the question is, which treatment is the best treatment for this child, for this particular situation? If you ask me, I always say, which treatment is best? All the tools are excellent tools. Yeah, it's the truth. Okay, but if you want to get the perfect outcome or an excellent outcome, you need to apply this tool or this intervention in a correct time and in correct way and in a skillful manner. Okay, if you are using the tool in a wrong time, so definitely you are not going to get the better result. Okay, if you are not skillful, then also you are not going to get a better outcome. Okay, so don't blame the tools. Okay, the tools are excellent. Okay, so it's the therapist's duty. He have to be skillful, and he have to know when to use it and how to use it and when not to use it. It's very important. Okay, right. Okay, to understand the techniques, each and every treatment techniques have its own strength and limitations. Okay, so it's very important as a pediatric physiotherapist to understand what are the strengths of the treatment technique. Then only we can think when we can use it. Okay, and also we have to understand what's the limitation of the treatment of this particular technique. So then only we can think about the other treatment technique which we can use now. Okay, in my opinion, if you ask what's the best treatment, I always say the integration model is the best. What it means was we have to combine the treatment techniques, 2 or more than treatment techniques, we have to combine together to treat the child. Okay, because we are treating the child as a holistic. Okay, at certain particular time, we are treating one or more different problems in a child. So we need to combine the treatment techniques. That's why you are skillful. Okay, that's why you need to understand the strength and the limitation of the treatment technique. Okay, it's very crucial. Okay, because we call the physiotherapist as a scientist and a detective. Okay, so you are that much powerful person. Okay, right. Okay, so now whatever the treatment you are using, whatever the treatment technique you are using, You have to, every treatment techniques need to have certain good qualities, certain parameters. Okay, now we are going to discuss a few of the parameters which we definitely want to have in our treatment technique. The first major important thing was we are not treating the labor. If the child was CP, we are not treating the CP. Okay, there's no any cookbooks to, okay, the child is CP, okay, we have to do this is intervention, then he will be fine. Never. There is nothing like that in the world. Okay, so that's why we are doing our assessments. Okay, the child was in front of you, you have to assess the child, find the root cause of the problems, and you have to use your skills to treat the children. Okay, every children are unique. It's a golden rule. Every child are unique. Okay, you have the child problem is unique problem and unique need the child's need was unique. Okay, right? So you have to assess the child properly and very clearly and in depth. So then you can deliver your service in a good manner. Okay, right. Okay, so the next important things, the pediatric physiotherapy is different approach than from the adult approach, because in adult they are already matured and there's a very few development and growth was happening. Okay, the system was then much stable. We know if there's something happens, what will be the outcome, what will be the impairment. We know it. Okay, for some extent. Okay, but in pediatric, the child was developing and growing, not only as a body, but each organ are developing, each body segment is developing and growing, and each system are developing and growing. It's trying to be getting matured. Okay, so your treatment have to be dynamic. Okay, because when the system change, we have to use a dynamic change in our treatment to achieve the goal. Okay, so pediatric physiotherapy, it's a very difficult thing. You have to be smart. Okay, right? Okay, okay, because as I said previously, it's the child was changing, the system, organs, movement, posture, everything was changing in the child. So as a pediatric physiotherapist, you need to know what is normal at that particular situation and what's not normal. Do I need to treat now, or do I need to wait for a while? Okay, for example, let's see the picture in front of you. Let's see about the knee alignment. Okay, so at the beginning of the stage, let's say before 3 years or 2 years, the child knees are apart. We call it bow legs, or we call it in technically genu varum. After a few years, after the 3 years until 60 years, the child show the knees are nearby. We call it knock knees, technically genu valgum. And after that, it will become to the normal alignment as an adult. Okay, the pediatric physiotherapy have to know when it was normal and when it was not normal. For example, if the parent bring the child to you in 1 year and he was saying, oh, my child's legs are in bow, knees are apart, is there something wrong with the bones? Okay, then you have to think, okay, what's the age? Okay, now it's physiological. Okay, physiological means normal. Okay, pathological means it's problem. So then you can advise the parent, okay, it's a physiological, so it's a normal process. The child is going in the normal process, and it will be changed in future. But even though for the same case, the child was in bow leg, even though it's normal, you have to check the normal ranges. Okay, so there's certain range, we call it normal. If the angle, if the alignment of knee alignment was greater than the normal, it's deviation. Less than the normal, it's also deviation. So then you have to start the treatment. Okay, so it's very crucial for the pediatric physiotherapists to understand the changes, the quality of the changes, and the quantity of the changes, and how we are going to help the parents. Okay, so definitely you need to think about that. Okay, when we come to the pediatric setup, most of the times, or some of the times, they say wait and see. But in my experience, I hate that word. Okay, because if it's deviated or if it's problematic, do the early intervention as soon as possible. Okay, so if you start the early intervention as soon as possible, you will get a better outcome, and there will be very less consequences or secondary complications. Okay, but if you wait and if you started to do the wait and see model, so you will be late. When you started the intervention, it's too late, and you are going to get poor outcome with so many complications, secondary complications. Okay, so it's very crucial as a physiotherapy. You have to understand what's normal, and when it comes to the deviation, you have to start the early intervention as soon as possible. Okay, it's very crucial. Okay, right. As the physiotherapy is an evidence-based practice, same like thing, the pediatric physiotherapy is an evidence-based practice. So you have to understand very deeply. The evidence-based practice consists of three major components: scientific evidence, clinical experience, patient values. The three components are major and highly equally important. But what happens in usually sometimes when I talk to the therapist or some students, so they only give the potentials to the scientific based research papers or journals. They say now they are doing evidence based practice, so they are only focusing on the journal. It's okay, but it's not perfect. The model says there are three components. Okay, because some of the things we can't prove it through the research. Okay, then there comes the clinical expertise. The clinical experience say which will be the best option or best intervention for now. Okay, right. So let's say you have a good evidence for a treatment A, and your clinical experience say that treatment A was the best. But what happens if the patient says, no, I don't like to do that? Okay, then definitely you can't do it. Okay, so then you need to change, you need to modify. Okay, so you have to remember pediatric physiotherapy or the physiotherapy is an evidence-based practice, but the evidence-base consists of three major components: scientific evidence and clinical experience and patient values. Those three components are equally important. Okay, so our treatment, I already said you, each and every children are unique. They have unique problems and unique needs. So your treatment have to be very unique for that particular child and for that particular situation. So individualized treatment, that's we can achieve through our assessment. Okay, so our treatment method is an holistic approach. Okay, what do you mean by holistic approach? We see the child as a whole. Let's say if the child comes to your office with a knee pain, are you only looking at the knee pain? If you are doing that, sorry, you are in a traditional model. You have to shift to the updated model. Okay, you need to see the child as a whole, because the other part of the body will influence the knee joint, and the knee joint may influence the other function of the other part of the body. So if you have to get a better result or better outcome, definitely you have to see a child as a whole. Okay, the holistic approach is very important. Okay, and the variety, it's a major key. Okay, all the physios, you have to understand the variety is the key. In order to achieve the variety, the therapists have to be creative. Okay, let's see the picture in front of you. You can see the child can sit in thousands and so many different ways. Every way are perfect and normal. Okay, so but what happens in our clinical settings? Most of the time, we train the children sitting on the floor like a cross sitting, and in the chair sitting. We only focus on those two things. But what happens if the environment or something change? The child need to adapt to that change. Okay, to adapt to the change, definitely he need to have an ability to change. So you have to give the variety of the variety to the children. So then he know how to adapt when the environment was changing or when the situation was changing. So the variety is very important when we when we go through the motor learning or motor control theories. So please be creative. Okay, it's very important. Okay, right. So I'll hold for a second, and is there any doubts? You can put it in the chat, and if you're okay, if you're fine and everything is fine, please put yes again. And if you have doubt, please let me know in the chat box. Okay. Any doubts, please, you can ask through the chat, or if you are fine, please respond and put yes, because I cannot able to see you guys, and your response is the feedback for me. Okay, I can see yes. Okay, thank you very much for your feedback. Okay, let's continue. Thank you, guys. Okay, you are giving more energy for me through the years. Okay, right. Okay, the parental involvement. Okay, in pediatric physiotherapy, we need to engage the parents. Okay, why you need to engage the parents? Oh, one thing, it makes your job easy. Okay, the parents is going to help you definitely. Okay, so then your stress was a little bit down, a little bit low. Okay, and the child was more confident because the child trusts the parent than me or than the therapist. Okay, so when the parent was there, he was very happy and confident, and he was less stressed, and he will engage whatever activity we are giving to him. And the third very important thing was, and at the end of the day, what we are going to do, the parent have to engage with the child in the home environment. So that definitely we need to educate the parents, or we have to do hands-on training to the parent how to support the children at home. Okay, so we can use the treatment session by engaging the parent into the treatment session. So then we can teach the parent how to handle their children. What's the strength and what's the weakness of the children? When you need to give support, and how are you going to give the support? So please get the parents help and encourage the parent to engage in the session. Okay, it's very important, and it's also legally you are safe. Okay. Okay. Right. So definitely we are dealing with the children, the activities or the exercise, or everything have to be as a fun activity and a play. It's not like a regular exercise, or you can't ask the child to bend your knees 10 times or raise your hand 10 times, or it will not going to work. If sometimes the child was a little bit older, then we can find, but most of the time it have to be play or fun. Okay, so through the play or fun activity, you have to develop the children, or you have to change the children whatever he needs. Okay, that's your specialty. Okay, fine. So we are moving to another important thing. When we are planning a treatment session, we need to think about three major components: the child, environment, and the task. Three of them are very, very important. Okay, what happened? We do a good assessment about the child. Okay, and we know what's wrong with the child. We always focusing on the weakness of the child, and we are trying to develop the child. But it's not the reality, because as a human being, as a child, our development and our things happen with the interaction of the environment and the interaction of the task. The environment influences the child in different ways, how he develop and how he going to move. Okay, so remember the ICF. Okay, there are three components like body structure, function, and activity, participation, environment factors, and personal contextual factors. Likewise, so definitely you have to take account about the child, what is the skills he had and what the skill he was lacking. And definitely we have to think about the environment, how we are going to change the environment in order to achieve our goal, in order to support the child to develop, or how we are going to plan the task which the child was able to do and which will help the child to develop. For example, if you are developing a upper limb function of the hand of a child, okay, if you are giving a bulk, a big rod which the child cannot hold it, so do you think it will help the child to develop? Never. It's going to help. Instead of helping, it's going to give you negative results. Okay, so it's very crucial whenever you are planning a treatment intervention, you have to think about the child factors and the environmental factors and the task factors. In my experience, what I will usually do was, first I will think about the environment and the task, because which we can change by ourselves. Changing the child is difficult. Okay, everybody knows we can't change others. We can try. It's difficult for us to change ourselves also. Okay, so definitely we need to change the child, but I give preferable at the first time. In my first list, I try to change the task and the environment in order to influence a child, and then I combine the child weakness and the strength in order to get a better result and the outcome. Okay, so always keep in mind, not only the child, you have to think about the task and the environment. Okay, right. So all the treatment have to be goal directed. Even though it's a play or a fun activity, the play have to be certain goal. The child have to achieve the goal. Then only he or she will be motivated, and he understand the process. Then it will be more fun. Okay, because then only you can give motivated. Wow, you have a good job. So he was psychologically strong, and he liked to engage more, and he liked to come back again. Okay, so it need to be goal directed. Okay, yeah, definitely it's a step-by-step process. We have to start from the simple one, and then we have to progress little by little to the complex. If you start from the complex one, definitely you will lose the child. Okay, right. Like how we do that? The thing was, if you know the impairment, this is the impairment thing. As a therapist, as a detective, you have to find deeper. What are the contributing factors? Okay, you find something and you dig deeper. What are the deeper contributing factor for this problem? Then you dig deeper. Then finally, you come to the fundamental elements which may be influencing the impairment. Like for example, walking. There are so many fundamental elements we need to achieve a walking. So then within the fundamental elements, you have to find out which element or elements are problematic. So then you have to correct the fundamental elements. Like you find that problematic fundamental element, you started to correct them through short-term goal. Okay, if you correct it, it will be positively impact other elements also. Okay, then you progress. Then finally you achieve a complete rehab as much as possible. Okay, right? So it's your physiotherapist. You need to identify the root cause, the fundamental elements. Okay, that's the speciality. Okay, that's the smartness of the therapist. Okay, definitely. You need to engage with get involved the child. The child need to do even a small piece. Okay, because most of the time when I ask the parents when they come back, have the child did the homework or home exercises? Yes, I did the 100 times with the child, but there's no improvement. Okay, says yes, the child will not going to improve because the child haven't done anything. You have done everything. Okay, then how you expect the development? Okay, so please encourage the child to involve. The therapist and parents are there to support, not to do the activity instead of the child. Okay, they are there to facilitate the child. Okay, please give enough support, as we said. But remember, you are facilitating, you are providing support. You are not doing the task for the child. The child have to do everything for some extent according to this stage. You are supporting it. Okay. So providing support is a dynamic one. At the beginning, you are doing most of the part was done by the therapist or a parent. A little part was done by the child because the child was not developed at stage. When times move on, you have to reduce your support and let the child to get control by himself or herself. And finally, the child was now able to do the stuffs by himself without any support or without less support. Okay, so it's a dynamic. Every time you have to change. That's the beauty of the therapist. The physiotherapy intervention is not a static one. It's very dynamic. Each and every time you have to change. It's the key. Definitely, it's a family-centered therapy. Even though the therapists have done very marvelous things, he had done a very hard job. But if the family is not providing you enough support, it's not going to give a better outcome. So it's very crucial for the therapist to educate the family, parents, father, mother, siblings, and other family members, about the child condition, how they can engage with the child, how we can give the opportunity to the child, how we can develop the children. So it's very important. Education is the key. Okay, then home exercises. We have to encourage the parents to do the home exercises. It's a must, because you are trying hard for 1 hour. After that, the 23 hours is with the child is with the parent or the family. If they're not doing anything, then it's not going to change anything. Okay, so you have to encourage the parents to follow the exercises, but you have to think what type of exercise we are going to give. Are we going to give, okay, bend the knees or bend the elbows? No. The home exercises are functional exercises, functional activities, which the child usually do at the home. You have to select the functional activities, and within the functional activity, you have to train the parent how to support or how to overcome the problems. Because at the end of the day, what we are training functional independence in the child. So our home exercises might be a functional activity. Okay, so you have to be creativity. Okay, and other thing, always, this is for the parents. Okay, don't compare the children with don't compare your children with other children. Okay, because as I said, every child are unique. Every child's talent and their abilities are unique, and their needs are unique, and the treatment is unique. So you have to believe the therapist, you have to believe the process, and you have to free to discuss with the therapist, and you can go further. Okay, but in my experience in previous years, I have understood the communication is the barrier when we think about the outcomes of the child, because the parents think the therapist know everything and he definitely he's going to help my child. The therapist think, okay, parents now can understand my way of my treatment. Okay, then he will go do it in the home. But definitely it's not happening. The therapist is in a different world and the parent was different world. The therapist goal was different, the parents expectation is different. Like in the picture on your left hand, one person's mind was in the printing machine, another person's mind was in the photocopy machine. They have in their mind, but they are not talking to each other. So then it's not going to happen, because whatever we do in the therapy session, the parents need to follow in the home. That's very important. So we, as a physiotherapist, you need to develop your communication skills, and you have to try to reduce the gap between your parent and the child and the therapist. Okay, so it's very important. Okay, so and we always encourage the parents to discuss with the therapist, because the parents might feel sometimes they were blind, they can't understand what's happening. So because they are already there in the stress when thinking about the children. Okay, so then we have to encourage the parents to talk whatever they feel. We have to allow the parents to come up with their ideas or come up with their problems. So then we can explain them, okay, this is happening to the child, this is how we are going to deal with this, and how it will going to progress. Okay, if we give a clear picture to the parents, so definitely they will do a better job. Because I have seen so many parents, they have really creative, and they are helping us in throughout the sessions. Okay, they are excellent, but as a therapist, you need to make clear the parents what's happening and what's going to happen next. Okay, so if they understood the process clearly, definitely they are going to help you. And encourage regular feedbacks, because you don't know what's how it's benefit for the children, your treatment intervention. So every time when I meet the parent or the child in the next session, I wish to talk with the parent for 5 minutes. Okay, for 5 to 10 minutes. How you feel? Is it okay? Is it helping you? Okay, or do you feel any difference, or you feel something to change? So I always welcome their feedback. Okay, then only we can get a better output. Remember, so we need feedback from everyone, then only we can give a better service. Okay, it's okay to ask the feedbacks. That's the good practice. And the final stage was reevaluation. Remember, we set a goal. Okay, we set a reliable, specific, measurable goal which we can achieve within a certain time period. After the certain time period, we have to evaluate. We have to invite the parents and the child, and we have to discuss, have we achieved the goal, or we haven't yet? Okay, it's fine. So what may be the reason, and how we are going to change our goal for the next sessions? Or are they happy with the therapy, or are their expectation are little bit different? Have they changed their expectations? So you have to reevaluate yourself. Okay, I know sometimes we can achieve the goal, sometimes we can't achieve the goal. It's okay. Okay, it's nothing wrong, because that's the that's because of the dynamicity of the child. Okay, so in both instances you are learning. Okay, if you succeed, you learn, okay, this is the correct method for these children, and now we can think about the next correct way. If it not succeed, okay, you can learn, okay, it is not the problem for the child, so I have to find the real culprit or real root cause for the problem. So then you have to do the assessment again. Okay, right? So every time it's a learning objective. Okay, so then you can do it perfectly. Okay, right. So before moving to this, I have to emphasize, because when people see this presentation and they might see, oops, okay, it's a long process. Do they take 1 year or more longer time to treat my child? Okay, no, not like that. Okay, so the initial assessment takes first 2 or 3 sessions. Okay, the goal was already will say set within 2 or 3 settings. It depends on the therapist. Okay, and depends on the patient's conditions. Okay, and the most of the time the therapy will start. The therapist will start the therapy from the first visit. Okay, because they will start from the basic things. Okay, right. So don't worry. The understanding of the process will be longer, but in reality, it was very short time. But as a physiotherapist, I highly emphasize, most of the time, 90% of our work was assessment. The 10% was the treatment. If you done your assessment very perfectly, you will find the root cause, and the treatment will be very specific and perfect, and you will get the result. Okay. Each and every treatment is also a form of assessment. That, like what I said, if you succeed, you know, okay, that's the correct way, then I can move it further. If you didn't succeed, okay, it's a learning. Okay, this is not the correct root cause, then you have to find the other root cause. So every time, each and every day, we are assessing the child, even though we are not saying, we are not doing in a formal way, but during the treatment we are assessing. Every time we are assessing the child, because whenever the child comes to the session, it's a new child. Okay, due to our treatment or due to other various factors, the child will change. So every time you need to assess the child, but not in a full assessment, but through the treatment we are assessing the child. Okay, okay. So it's very important for the child. There are so many people are involved: the physiotherapist and the therapist, or the doctors in the multidisciplinary team, because most of the time the clinical model was multidiscipline, and the parents and family members and others. So everybody need to understand the goal, and everybody need to understand the child and the process, and everybody need to work together, because otherwise we can't achieve anything. If one person is not working together, then it will be a problematic. Okay, so that's why discuss with everybody who are working with the child, and we have to work together to achieve the goal. Okay, because everybody are working to the benefit of the child. Okay, so it's free. That's a good practice. That's why where it comes multidisciplinary approach. Okay, and if everybody are working together, we can get a very holistic development. Okay, it's the child will get a better output, better outcome. Okay, right. So that's the end of my session. If you have any questions, I can answer the questions now. And first of, thank you everybody to listening me. So I have given my contact details. If you have any doubts or clarity, you can contact me. And okay, so I'm now ready to get the questions. Okay, I'll check the chat.
Thank you, sir, for the valuable knowledge you have been sharing with us all this time. It indeed
Welcome.
was very useful, and I hope it was the same with the audience as well.
Okay.
This is the time for a Q&A, so please feel free to drop your questions to chat box or send them to our WhatsApp group, and we will wait a few minutes for you.
Okay, right. So I get the question before. I think there's someone was asking about hydrocephalus. Okay, right,
Excellent.
right.
May I read it?
No, I can see. Thank you. Okay, right. So 1 year baby can't even turn on their own diagnosed hydrocephalus stage 1. Okay, please suggest some core strengthening exercises. Okay, again, I don't know the person. Okay, I don't know whether he or she was therapist or parent, but first you have to understand the human movement. We are not only focusing on the core strength, just definitely we need the core strength for the child. Okay, but the core strength was achieved through the movement, through the upper limb movement, or through the lower limb movement, or through the breathing exercise. Okay, so we can achieve the core strengthening in various ways. So as I said, we have to find what is the reason. Okay, why the child was having weaker core. Okay, because in my terminology, I don't like the word strengthening, because usually we don't need the strength. We usually we need the tone. Okay, a basic tone for everybody to do our aerial activities. Remember, none of us are going to the gym to at our childhood to make us walking. Okay, so it's not about the strengthening, it's about the coordination. Because if your muscles and if your body parts are coordinated well, we call it synergically well, so then definitely you are going to develop a good strength or good movement and good posture. Okay, so as you said, it's a hydrocephalus stage 1. Okay, then you know there's some component of neurological problem. So then you have to clearly understand, according to his condition, it's a neurological condition, something we have to do with the brain. Okay, because due to the hydrocephalus, what happened, the brain was getting a little bit damaged or compressed. Due to that, it is the cause for the development delay. So if you are thinking about core strengthening is a musculoskeletal phenomena. Are you like to do a musculoskeletal intervention for a neurological condition? So yes, definitely we need to develop the core strength, but in a neurological way. Okay, so you have to educate the brain, or you have to change the brain in order to achieve the core strengthening. As you said, the child was still not turning. Okay, so because we have to understand why it was turning. Rolling is a functional task. For the functional task, there will be so many reasons. There may be any visual problems or musculoskeletal problem or any other components, or might see sometimes he was missing previous milestones. Okay, so you have to be more clear. You have to assess the child very clearly, what's the strength and what's the weakness. Okay, if the child was unable to roll, okay, it's a pathological, I can see, because usually the baby have to turn around before 6 months, but now 1 year. Okay, you have to definitely have something, but your intervention have to aim to the neurological development, not to the musculoskeletal. Okay, you have to develop the neuroplasticity in the brain, then you have to develop the synergy in the brain, and you have to do some then through that you will develop the core strengthening. So it's better you can use Bobat approaches or PNF approaches or other stuffs. It's okay, but definitely you need to do a neurological intervention. Okay, okay. So because I can't give a great straightforward answer because I haven't seen the child and I need more data. I remember I have to do the assessment. In the assessment, I need more data to give you a specific answer. Okay, right? If you have any doubts, please put it in the chat further, so then I can guide you better. Okay, so I'll go through the WhatsApp. There are a few questions in the WhatsApp. Okay, so the first question was, what are the types of the neurological problems in children treated by pediatric physiotherapy? There are tremendous. There's huge. Okay, we can give some. For example, I can see the cerebral palsy. When we consider about the neurological condition, there are two major parts. Some kids may have some central nervous issues like problem in the brain and the spinal cord. Some children may have some problem in peripheral nerve. like Bell's palsy or some Erb's palsy. Some children may have combination of the problems. Okay, so then you have, there are so many types. Okay, I have given some few examples: cerebral palsy, spina bifida, or then autistic, um, herb palsy, or any other conditions, or some other brain trauma or accident to the due to accidents. There are several, there are thousands. Okay, right? So definitely, whenever the neurological problem, we definitely need a physiotherapist. Okay, right. So that's the second question. Okay, if you are if you are okay with the answers, then it's fine. If you are not okay, please ask the details from the chat. I am happy to give. I am happy to elaborate those stuffs. Okay, right. What's the most common neurological disorders in babies? Usually, it was cerebral palsy in my experience. Uh, when I consider the conditions who are coming to the physiotherapy, usually the cerebral palsy or development delays, okay, due to neurological conditions, okay. Because it's nice question, we had to remember the physiotherapy start from NICU, the baby room, which we know. From the birth of the child, sometimes we need to do our physiotherapy due to preterm deliveries, okay, right. So what is appropriate, what is, when it is appropriate to reevaluate a patient? Okay, it's a good question. But the thing was, it depends on the condition of the therapy and how often we are meeting the child. Okay, there is not a certain rule. Okay, right? If, for example, if I am meeting the child every day, then my reevaluation will be 10 days. But it's not be the specific, because if the condition of the goal was a little bit tricky one or a little bit harder one, I will go for 2 weeks or 15 days. It depends. Okay, there's not a hard or cut rule. Okay, it depends on the frequency of the child when we are seeing the frequency of the session and the condition, and depends on the goal. Okay, right. So the next question, how does a physiotherapy help a children with cerebral palsy? Yes, the cerebral palsy, when the child with cerebral palsy having problem with movement and posture and other secondary issues. Okay, physiotherapy is the, how to say, is a expert or is a key person to help the cerebral palsy, because he's the master about the movement and the posture. Definitely they can help the child to make functional independent in as much as possible, because sometimes we can't make the child as normal, but we can try to make them to reach near normal, because it's dependent when we are starting. If we are starting early, then definitely we are going to get a better result. Okay, right. What are the skills a pediatric physiotherapy should have? Whatever I discussed today, you need at least those of the things. Okay, first you have to learn, you have to update your knowledge, you have to do so many practices, and you have to learn yourself, because the knowledge and the skill is the key. Knowledge is the power. Okay, every time, each and every second, you have to learn. You have to learn from the child, you have to learn from the expertise, you have to learn from the books, you have to learn from the parents, you have to learn from the articles everywhere. Every single second, the therapist need to learn. That's a skill. The learning is the skill for the therapist. Okay, the learning the skill and the knowledge. Okay, right. The second thing, how to become a pediatric physiotherapist. It's simple. You have to have a good knowledge about the pediatric. You have to develop the qualifications regarding the pediatric physiotherapy. You need to develop the skill regarding the pediatric physiotherapy, and you have to work with the children. That's it. Okay, but it's easy to say, but there's a long process. Okay, but you are always welcome. Okay, right. The next thing. No, that's the end of, I think. Okay. Yes, she have a neurological disorder. That's why I have asked a treatment plan for a proper development initially head control. Yeah. Okay, definitely. Okay, because you have to understand, we have to see, because the development milestone are the task. Okay, you have to understand it's a end goal. To achieve the end goal, there are several steps, several skills the child have to develop. For example, if you're thinking about the head control, right? At the end of the 3 months, the child will raising the head in the prone. Until 3 months, for 3 months, what the child was doing, the child was developing his skills. So in order to develop the task, you need to identify the skills. Remember, I'll go for the slide. Okay. Why did I move it here? So remember this picture. In the big pyramid belongs to head control or rolling. To achieve this goal, there are several elements. There are so many basic elements. Those are skills. First, identify which skill is problem, because I know you are asking you are expecting an exercise. So it's difficult for me to give the exercise because I need to understand which element is the problematic. Okay, so it's a very important thing to understand. We have to understand whether he's having some issues in coordination in the muscles, or if there any problem is in between the agonist and the antagonist, if the synergy is missing somewhere, or is there any, if the child is having any spastic related stuffs, or whether the child was having any other stability related problems, which because the child need to have a stability to develop the mobility. Because I was giving some clues, right? Each the child, when we consider the child development, there are several steps to follow. At the beginning, the child will develop the stability, then the child develop the control mobility, then after that the child show the movement on top of the stability. This is the 3 steps which goes in the correct order. Rolling is an mobility. If you or head control, raising the head or keeping the head in the middle, is a movement. In order to achieve that, you have to go back. Does the child having control mobility for that? Or does the child have the stable base in order to do that? Okay, those are very basic when we consider about the neurological perspective, because the nerve, the brain think in that way. The brain first lay down the stability factors, and then he started to do the mobility factors on top of the stability. Okay, right? So to answer your question, you need the answer was, which always I hate, is you need to find the culprit. What is the factor? Okay, so but you can encourage the child with the movement, but remember, if you are making the child to do the task again and again, like making him to roll again and again and again, or making the child to raise the head again and again, it is not going to help you. It is not correct practice. Doing a task again and again, it's not going to happen, because the child, a normal child will never do like that. Have you ever seen a child doing sit and stand every time to get the sit and stand, sit to stand? Never. Okay, the child was developing his skills. When he developed the skills, whatever needed for the task or the milestone which you are highlighting, then the milestone will be automatically be achieved. Okay, so think the skills. Okay, you need to be critically analyze what are the skills or what are the fundamental component missing in the child. If we haven't figured out the fundamental component now, then the development will be delayed, or the development will be not achieved in an expected way, because the fundamental component will affect each and every milestone. Okay, so then definitely you need to think about, so if you need, how I can know the skills, it's simple. You need to understand the normal human movement and normal development of the child, then it's perfect. Okay, right. So is there any questions?
I think that's all, sir.
That's all. Okay. Okay, thank you very much, and thank you for your invitation, and hope you will be safe and healthier. Thank you very much. Okay, and see you soon. And best of luck for the future activities.
Thank you, sir, for your very
And thank you thank you everybody to be patient and listening to me. Thank you very much. I'm happy if I made something to you. Thank you.
Definitely. Thank you, sir, for your valuable time despite your busy schedule and for letting us have such an amazing, knowledgeable session regarding pediatric physiotherapy. And we have sent your feedback forum to participants, and we hope you will drop your feedback to us. And we have shared it to the WhatsApp group as well.
Okay.
And so you can feel it. And I would actually like to thank you again for sharing your knowledge and expertise with us. And you have cleared many doubts we had about pediatric physiotherapy.
Okay, and if it's possible, please send me the evaluations also, because I need to evaluate myself.
Yeah.
Okay, then it will be helpful for me to give a more efficient way in future.
Sure.
Thank you.
And I guess now is the time to wind up the session.
Okay.
And I would like to remind that there will be another session starting exactly at 7 on the very same topic in Sinhala, brought to you by Mr. Nuan Rodrigo. And I ask you to grab that opportunity as well. Thank you, everyone,
See you
for
soon.
joining us and for yourself.
Okay, great.